Hello, and welcome to the world of families of children with club feet. My name is Eric Richard, and I have a vested interest in the treatment available for children born with club feet. I was born with this condition and underwent surgery when I was a child, and as a result, although the position of my feet was corrected, I consequently suffered with pain and discomfort for some years after. Although with the support of complementary therapies and acupuncture I was able to overcome this condition, but I'm delighted to let you know that now your child doesn't necessarily have to undergo surgery to correct their club feet. Time has moved on, and there's another treatment available now called the Ponseti method, which is much kinder to children's feet and has had fantastic results, a success rate of 95 to 98%. There are different treatments available for club feet, including surgery and the wearing of splints, but I, like many thousands of people throughout the world, believe that the Ponseti method is the best and most successful way of treating club feet. I do hope you will find this film interesting and helpful, and that you will take inspiration and hope from the children you are about to see. What is club foot? Well, an otherwise normal foot turns into a club foot during the second trimester of pregnancy. The foot is turned inwards and resembles a club, hence the name club foot. The condition is also often referred to by its medical name of talipes, or more properly, congenital talipes equinovarus, or CTEV for short. Club foot is often diagnosed on an ultrasound scan, although ultrasound cannot predict how severe the club foot is. There are many theories about the causes of club foot, but these are not conclusive. Many parents feel guilty when they find out their child has been diagnosed with club foot and wonder if they could have done something different to prevent the condition occurring. Parents should not feel guilty in any way. It's just one of those things that happens and needs to be dealt with. If your child has recently been diagnosed as having club foot, either during an ultrasound scan or at birth, you will obviously be concerned. However, I hope that this film will reassure you and show you how easily the condition can be successfully treated so that your child will lead a completely normal life. The Ponseti method of treating club foot was developed many years ago by a Spanish surgeon, now working in Iowa in the United States, Dr. Ignacio Ponseti. After a few years of operating on feet, he became convinced that surgery was the wrong approach for the treatment of club foot. Instead, Dr. Ponseti developed a method of gradually manipulating the foot into the right position over a few weeks, and then maintaining the correction by the wearing of a special brace. Treatment of club foot normally starts when the child is just a few days old. Firstly, the feet are examined to determine the severity of the club foot. It's important to remember that even the most severe, stiff club foot can be successfully treated using the Ponseti method. The practitioner will gently and expertly manipulate the foot towards a correct position. This position is held in place by the application of a plaster cast, which normally stays on for between 5 to 7 days. The child then returns to the hospital to have the cast removed, further manipulation, and another plaster cast fitted. This cycle continues for up to 8 weeks, depending on the severity of the club foot. You will be amazed each week as you look at the difference in your child's feet and the changing shapes of the plaster casts. As the foot is moved into the correct position, the ligaments are stretched and the foot becomes more flexible. Often, at the end of this series of plaster casts, a simple procedure called a tenotomy is carried out. This involves snipping the tendon at the back of the heel, which allows the foot to be more flexible when pointing up and down. This procedure takes seconds, and it may be performed under local or general anaesthetic. The foot is then put back in plaster for 3 weeks so that the tendon can regenerate. Parents are often worried about this part of the treatment if it's needed, but it's a very minor procedure. There are no stitches, and it can often be difficult to tell where the slip was made. After the last cast has come off, the foot has now been corrected, and I think this is fantastic. However, now comes what has been described as the hardest part of the treatment. This is when the continued care of the child's foot moves from the practitioner to the parents. It is really important to maintain the correction that has been achieved with the manipulations and plaster casts. So, in order to prevent a relapse, the child now has to wear a special foot brace, which is a pair of shoes attached to a metal bar. The brace, which holds the foot in an overcorrected position, has to be worn initially for 23 hours a day for 3 months. But after 3 months, in most cases, the time in the brace is reduced to between 12 and 14 hours, usually at night and during nap times. It may take a few days for you and your child to adjust to wearing the brace. There may even be some tears and sleepless nights initially, but this is short-lived. It is important that the brace is correctly and securely fitted. This will ensure that the correction is maintained and the risk of sores and blisters is reduced. Once children are used to wearing the brace, you will be astounded at how quickly they discover new and different ways of getting around. Children can sit up, crawl, and even walk in the brace. None of the milestones in their development are adversely affected. In fact, some parents claim that the brace strengthens their child's leg muscles and enables them to sit up more easily. During the time that your child is wearing the brace, you will encounter some practical issues. For example, your child may knock the bars on their cot at night and wake themselves up. All these issues can easily be overcome, and if you are in touch with other parents in the same situation, you can always share helpful tips with one another. Occasionally, some children will need a little more intervention at around the age of 3. This may involve moving the position of a tendon in the foot to make it pull in the right direction. This is not major surgery, but if required, it is an extremely successful procedure. So that's it. After 4 years, the brace can be discarded and your child's foot will remain corrected without the need for major surgery. There is no scar tissue, no reason to expect pain, arthritis or stiffness. Instead, your child can look forward to a completely normal life and probably won't even remember having had clubfoot.